How does a skin biopsy diagnose melanoma? Imagine noticing a mole on your skin that looks a little different from the rest. You might wonder if it's something more serious like melanoma. The way doctors find out is through a skin biopsy, which is a simple but very effective test. When a doctor suspects a mole or spot might be melanoma, they will perform a biopsy to get a sample of the tissue. This sample is then examined under a microscope by a specialist called a dermatologist. This expert looks carefully for cancer cells to see if the lesion is benign or malignant. The biopsy helps determine if the suspicious area is harmless or if it's melanoma, which is a serious form of skin cancer. It also reveals how deep the melanoma has grown into the skin, which is crucial for planning treatment. The process starts with a physical exam where the doctor looks at the mole or lesion. If they think it might be melanoma, they will numb the area with local anesthesia so the procedure is comfortable. There are different ways to do a biopsy, depending on the size and appearance of the lesion. One common method is an excisional biopsy, where the entire mole along with a small margin of normal skin is cut out with a scalpel. This method is preferred because it allows the doctor to see the full thickness of the lesion and assess how deeply it has invaded the skin. For smaller lesions, a punch biopsy might be used, which involves removing a small, circular piece of skin with a special tool. Sometimes, a shave biopsy is performed, where only the top layers of skin are shaved off, but this is usually for lesions with low suspicion of melanoma and must include the full lesion to be effective. Once the tissue is removed, it is sent to the lab. The dermatopathologist examines it under a microscope to look for melanoma cells. They measure the Breslow thickness, which indicates how deep the cancer has penetrated into the skin. This measurement is the most important factor in predicting how aggressive the melanoma might be. The pathologist also checks for other features like ulceration, how quickly the cells are dividing, and whether the tumor has spread beyond its borders. This detailed microscopic analysis helps doctors determine the stage of the melanoma and decide on the best treatment options. It might lead to further surgery or additional therapies if needed. The biopsy is a vital step because it provides a definitive diagnosis, helping distinguish melanoma from benign moles or other skin conditions. It also guides the management plan to improve outcomes and support skin health. In summary, a skin biopsy diagnoses melanoma by carefully removing a small sample of suspicious skin tissue, which is then examined by experts to confirm the presence of cancer cells and understand how advanced the tumor is. This process is safe, precise, and essential for ensuring patients receive the right treatment. Always remember, if you notice any unusual moles or skin changes, consult a healthcare professional for proper evaluation and care.